Assalamualaikum to all of you. Welcome back to my channel, Mr. Medical. Today we are going to discuss about our new series, Pathology. Okay. सबसे पहले तो मैं आप सबको कार्डिक पैथोलॉजी स्टार्ट करने से पहले ये बताना चाह रहा हूँ कि उससे पहले आपको द वर्ड आर्टेरियोस्क्लेरोसिस का वर्ड पता होना चाहिए कि इसकी डेफिनेशन क्या है, इसकी एक्सप्लेनेशन क्या है, ठीक है ना। जब ये कर लोगे तो उसके बाद आपके लिए जो मायोकार्डियल इंफार्क्शन है वो इजी हो जाएगा ना, ठीक है ना। तो सबसे पहले हम आर्टियोस्क्लेरोसिस देखेंगे, उसके बाद हम पे कार्डियोवैस्कुलर पैथोलॉजीज देखेंगे। ये आर्टियोस्क्लेरोसिस है, ये बेसिकली वेस्कुलर पैथोलॉजी की क्लास में आती है, ठीक है ना। तो सबसे पहले हम आर्टियोस्क्लेरोसिस को देख लेते हैं कि व्हाट इज आर्टियोस्क्लेरोसिस, ठीक है। आर्टियोस्क्लेरोसिस लिटरली मीन हार्डनिंग ऑफ arteries. Okay, there are basically three main types. The first one is the monkey belt medial sclerosis. This monkey belt medial sclerosis basically damage tunica media. You just need to remember about tunica media only in this monkey belt medial sclerosis because this cannot harm the normal person. Okay, so this can damage tunica media. Okay, where smooth muscles are clustered off. Okay, clinically this cannot be important because this monkey bug medial sclerosis cannot harm a normal person. Okay, the second one is arteriosclerosis. Arteriosclerosis, basically hardening of the arterioles. This arteriosclerosis is usually seen in, first of all, which media will be damaged. In this case, also a tunica media damage. Okay, and which arteries mostly damaged in this arteriosclerosis? Basically, this is seen in muscular arteries. Muscular arteries we can define as limb arteries or peripheral arteries like radial arteries, peripheral arteries like example tibial artery, okay, radial artery from the upper limb like brachiocephalic artery from the upper limb. That's all the muscular arteries. Okay, so the third one is, let me again define arteriosclerosis because it has two again types. Like first one is we designated as A and B, hyaline arteriosclerosis. Okay. This hyaline sclerosis is seen in advanced age people. This is normal with advanced age. Okay, we all know that within the advanced age our arterial walls start become thickening. Okay, so that's we it called saline peoples, mostly seen in saline peoples and people who have hypertension. Okay, and diabetes mellitus. Why diabetes mellitus? We all know that diabetes mellitus can cause vascular neuropathy. Every diabetes mellitus can cause neuropathy. It may be retinal neuropathy, it may be vascular neuropathy. In our peripheral regions, gangrene occurs due to the vascular neuropathy. What happens in diabetes mellitus induced vascular neuropathy? Basically, for example, these are our legs. Two legs. Everyone have two legs. Okay. These are our foot. So what happens in this case? We all know that the supply to our lower limb is minimal rather than our upper limb. So that's why this supply to our lower limb is minimal rather than upper limb. If there will be a diabetes mellitus to a person, what will happen to that person? This diabetes increase sugar level, decrease sugar level, or increase sugar level can cause damage to the vascular structures. So what happens? These already we know that here the supply to our lower limb is minimal. So if there will be a strictness or maybe constriction to the blood vessel, so again blood will be reduced to our lower limb periphery. So what happens if there will be a wound in lower limb like in foot? Okay, what happens? We all know that blood requires for fast healing. So blood already diminished, blood have already diminished supply to the lower limb. What happens? This wound cannot be healing properly, or maybe infection occur, and this infection lead to gangrene. So that is the problem in diabetes mellitus patients. Okay, the second one is we designated as B, hyperplastic arteriolosclerosis. Hyperplastic arteriolosclerosis. In this, media has undergo hypertrophy also and hyperplasia also. Okay, and mostly seen in during hypertension. Patients who have hypertension. Hypertrophy also seen in this case, and hyperplasia. In hypertension, what happens to our left ventricle or arteries if there will be a total peripheral resistance? Hypertension is due to the total peripheral resistance. What happens? Pressure generated, overload, overwork generated. So if there will be an increased work demand, we know that our cells start doing more, produce more organelles, more proteins, and our cell become more overwork. So that's why hyperplasia and the cells start doing hyperplasia and hypertrophy. They grow in size and they multiply. So that's why hyperplastic arteriosclerosis is mostly seen in the patient with who have hypertension. The third one is not the arteriosclerosis, the main. The third one is atherosclerosis. The main type we have to discuss in detail now, because the upper two have no much clinical importance. Okay, the atherosclerosis have vast clinical importance. You ever seen in your life myocardial infarction? This patient confirm 100% have atherosclerosis in their coronary walls or coronary arteries. Okay, what happens in atherosclerosis? Basically, it is a disease in which damage to tunica intima occurs. And we all know that what is tunica intima. This one is like, this is tunica intima. Okay, this is interstitial fluid compartment. Okay, and here are some endothelial cells. We all know that our lumen of the blood cell contains endothelial cells. Now here is tunica media, this one, and we all know there's and tunica adventitia. That's all. Okay, this disease is cause damage to the tunica intima. Okay, and mostly this damage can cause to the coronary arteries. Okay, if there will be a disease in coronary arteries, then we all know that there will be incidence of myocardial infarction, angina pectoris, stable angina, unstable angina, premental angina. But premental angina have different story, because premental angina may be occurring normal person who have no atherosclerosis plaque. Okay, so it may be seen in carotid arteries. Okay, and it may be seen in circulophilis, cerebral, we call blood brain barrier be also. Okay, the circle of Willis present in our brain. Circle of Willis, remember the mnemonic cough. What is the incidence of atherosclerosis? Incidence of No, in your brain, in your mind, you just quickly remember that incidence of atherosclerosis is more in like coronary arteries, because every day we got a patient of myocardial infarction, okay, but not. Why? The incidence of atherosclerosis is main in abdominal aorta and the less in coronary arteries and the less in popliteal arteries, okay, and less in carotid arteries and less in circle of Willis. What happens during the atherosclerosis? Atherosclerosis may lead to aneurysm. Okay, atherosclerosis may lead to rupture in the cell wall. Oh, sorry, cell wall in the coronary vessels. Okay, in any vessel. Okay, why abdominal aorta have large incidence or great incidence of atherosclerosis? Let me draw a diagram. We all know that this is our abdominal aorta. Here are common iliac arteries and left and right. So let's assume just before our abdominal aorta there is a vertebra. Okay, heart. We all know that our vertebra is heart-like subject. Okay, whenever there will be a systolic pressure, we all know that from the left ventricle blood push into the aorta and going into the systemic circulation through the abdominal aorta or to the upper aorta. Okay, through the carotid arteries, etc., etc. Whenever systolic, there will be a systolation. That means contraction. Contraction means blood pulls into the aorta. Whenever every with every systolation, our abdominal aorta beeps. Like this one is normal, and whenever systolic function of the heart, this aorta will become like beep. Like you may feel the pulse whenever you put your hand into the front of your abdominal. Okay, whenever our aorta will beat, this bulging of, for example, here our aorta is beep out. Okay, then this beep out will connect with our posterior vertebra pressurely. So that's why if some soft structure hardly fall on a large or hard subject, then what happens? Like this is a butter, for example, just assume, and this is a brick. When this butter fall pressurely on the brick, what happens to this? This may be ruptured. So that's why in abdominal aorta, atherosclerosis is more common. Our aortic our abdominal aorta continuously beep out and beep in. So can they can beep out with the vertebra. Okay, and what happens during atherosclerosis in abdominal aorta? I just told you about upper. At what happens in the abdominal aorta? What happens atherosclerosis in abdominal aorta? Okay, so whenever there will be a beat into the abdominal aorta, atherosclerosis cause aneurysm into the abdominal aorta. Okay, so that's why atherosclerosis may lead to rupture, may lead to aneurysm, may lead to rupture in the chronic wall, or may lead to uh, blockage of your abdominal aorta. Abdominal aorta not may lead to constriction or may lead to blockage of your artery vessels, mainly in coronary arteries. Okay, in circle of Willis we also find aneurysm that is called berry aneurysm. I think a berry aneurysm. We not go into much detail of circle of Willis, but you just need to remember if there will be aneurysm in circle of Willis, then you will find berry aneurysm. Okay, just forget about it all. Now let's move forward. Okay, atherosclerosis have important and extreme importance. So that's we will discuss only atherosclerosis. This is a disease of tunica intima. Okay, damage elastic and medium size arteries like coronary vessels, okay, like abdominal aorta also, okay, then popliteal arteries and circumvallus, etc. I already explained about. What is the pathogenesis? Okay, currently head view of pathogenesis is embodied in the response to injury hypothesis. What happens? Basically, this injury related to the inflammation, yeah, or inflammatory process. We all know that what is inflammation very well now. Okay, we all know that if there will be a normal endothelial cells, there is not much leakage of protein into the injury sites. Sorry, normal. Just assume this is a normal size. And if there will be injury to the endothelial cells, whatever cause, okay. No, let me draw a diagram. No, here is a gap between endothelial cells. What happens? From the circulation, a lot of proteins leaks out into the injury department or maybe into the interstitial compartment. Okay, ECG injury can cause increase permeability. Okay, and we all know that in inflammation, the increased leukocyte adhesion occur. Okay, and if there will be increased adhesion leukocytes, then what happens? The chances of thrombosis increase will be increased. Okay, accumulation of lipoproteins, oxidized LDL, especially oxidized LDL and cholesterol crystals also increase. Okay, we all know that first of all in transient inflammatory monocytes comes, and monocytes come in when come into the injury department or maybe injury site, they convert into the macrophages, and macrophages start releasing inflammatory cytokines. Okay, smooth muscles cell recruitment due to the factor release from activated platelet macrophages and vascular wall cell. What happens? What happens in endothelial cell injury? Just endothelial cell injury. Okay. Whenever there will be injury to the endothelial cells, more permeability occurs that cause influx of LDLs to tunica intima. For example, this one is our endothelial cells, okay, and this one is our tunica intima, okay, and now this is our tunica media, which consists of mainly smooth muscles, whatever. Okay, this is normal. What happens when there will be injury? There are gaps created between endothelial cells. These are gaps, and protein leaks out, leukocyte leaks out from the lumen into the tunica intima department, or maybe we call interstitial department. Okay, what happens? Injured endothelial cell cause increased adhesion molecule, so monocyte attached to the receptor expressed on injured endothelial cells. These receptor called VCAM. We all know that the process of inflammation. What are VCAM? Vascular cell adhesion molecule 1. Vascular cell adhesion molecules 1. In short term, we call VCAM 1. These are increase during the endothelial cell injury. So that's why monocyte attached to the these adhesion molecules, that is called vascular cell adhesion molecule, that are released or that are triggered during the endothelial cell injury. What happens? These molecules helps monocyte to migrate to the injured site. For example, here are monocytes, very small monocytes. Okay, these are some monocytes. Now, on the surface of endothelial cells, they represent VCAMs, okay, receptors. Maybe monocytes have ligands. When they attach into the this can bring a change into the direction or movement. Then monocytes are present in injured sites or maybe in the tunica intima. Here the monocytes convert into the like macrophages. You know what, macrophages are dangerous. They are defensive, but they are dangerous also because they can cause atherosclerosis. Okay, so everything in balance is good. Everything in low quantity or maybe excess quantity is contraindicated or maybe it's disaster for us. Okay, so what what happens after that? Platelet, lymphocyte, T lymphocytes are also attached. We all know that they have in our blood. Platelet is also present. Okay, T lymphocytes also present. They also attach to the same protein like we can, and PCAM also available. P-selectin, E-selectin. These are proteins. These are ADN molecules we learned in inflammatory process. Okay, so I don't need to go into detail in this process. What happens with E-selectin? What happens in P-selectin? What are the cellulose sugars molecules and whatever. Okay, so that's why platelet and lymphocytes also start migrating into the intima. Macrophage after conversion start producing a lot of chemicals, mediator and growth factor. We all know that after inflammation there will be a process of healing, and in process healing they start growth factors like TNF, okay, tissue tumor necrosis factor, okay, tissue growth factors, fibroblast factors, etc, etc. So macrophages start releasing growth factors and other leukocytes or cytokines. The first one is interleukin 1, the second one is TNF alpha, and the third one is monocytic protein 1. Monocytic protein 1, or we just it's simply called as a mnemonic or as a short form is MCP1. Now after that what happens? The T lymphocytes present in our lumina intica, tunica intima, what they start? They start producing interferon gamma. T lymphocytes start producing interferon gamma and lymphotoxins. Actually, what is the function of T lymphocyte? Basically, they have to digest or they have to phagocytose the foreign molecules, okay, and foreign small molecules. So they start interferon gamma and lymphotoxins that are good for us when we have infection, but not good for us when we have normal functions in our body. So they stimulate macrophages. These two plus lymphotoxins, these both stimulate macrophages. So what happens next? Macrophages stimulated by lymphocytes, and then macrophages stimulates again T lymphocytes. They both stimulates each other like husband and wife. Okay. Now platelet derived growth factor released by the platelets. We all know that platelets are also squeezed out into the injury sites from the injured endothelial gaps. Okay. What happens? Platelet derived growth factors released by the platelets that again stimulate. These can also lead to stimulates macrophages, and these also lead to stimulate lymphocytes. So just quick recap: lymphocytes that are reaching into the T lymphocyte that reaching into the injury site, they start producing interferon gamma and lymphotoxin that stimulates macrophages. Whenever macrophages are activated, macrophages start stimulating T lymphocytes. Okay, we all know that platelets are also present into the injury sites. What they cause? They cause again stimulation of the macrophages, and they also cause stimulation to the T lymphocytes. Okay, so what happens? Smooth muscles start movement toward the site of injury from the tunica media. This one is tunica media, and we all know that tunica intima, the blue one, and the tunica media is the full of smooth muscle is tunica media. Now Smooth muscle start movement toward the site of injury, shifted from media to the intima. Maybe here is a rupture to the tunica intima. Okay, so that's why these smooth muscles start shifting from the tunica media to the tunica intima. Macrophages and smooth muscles start eating. Now what happens? Macrophages, macrophages that already presents in our injury sites, they also here. Okay, no, they are smooth muscles also here. Smooth muscles plus macrophages start eating LDL that leaks out into our injury site from the luminal side of the arteries or venules, etc. blood vessels. Okay, they start eating LDL. We all know that LDL is not is LDL is a bad guy. Okay, they always try to harm your body. HDL is a very good guy, but this one is very bad guy. Always in mood to try to harm your body. What happens when when macrophages and smooth muscles start eating LDL? They become foam cells. We call simply lipid loaded cells. For example, this one is macrophage and this one is our smooth muscle cells. Uh, Here is a lot of LDL present between them. These are called foam cells. Okay, these are called foam cells. LDL is oxidized by free radicals and damping the nitric oxide ability to dilate vessels. What did LDL do with the endothelial cells? We all know that endothelial cells secretes nitric oxides. They can harm to the endothelial cells to produce, to cannot produce or cannot induce to secrete nitric oxide. So that's why they decrease or maybe they oxidized by free radicals and damping it decrease the quantity of nitric oxide. So that's why we all know that the function of nitric oxide is to dilate the vessel. And LDL, what happens opposite to that, they start inducing the endothelian hormones secreted by endothelial cells. And what is the function of endothelian function is to cause vasoconstriction. So LDL also cause decrease in nitric oxide, and it is also called increase in endothelium. Okay, the oxidized, what more thing is should need to remember is that the oxidized LDL is far more dangerous than normal. Okay, the oxidized LDL is far more dangerous than the normal or simple one. Okay, now let's move forward. What happens? Oxidized LDL act as a chemotactic agent and stimulate release of growth factors. Now, oxidized LDL also cause damage to our body. This guy is always bad to our. Okay, but no, he make a company of bad guys again. Okay, like free radicals are also bad guys, and they make a company with them. So what happens? The oxidized LDL act as a chemotactic agent and to stimulate in these growth factors, cytokines and chemokines. What happens? Increasing monocytes and also cytotoxic to endothelial cells and chemotactic factors, chemotactic for smooth muscle cells. What they cause? They cause increase in growth factors. Okay, they cause increase in monocytes production. So that why monocyte convert into macrophages and macrophages stimulates T lymphocyte. T lymphocyte produce interferon gamma and lymphotoxin that again stimulate macrophages, and macrophages also stimulated by platelet derived growth factor that is released by or that is chemotacted by oxidized LDL. Also, the one more thing is that they also chemotactic for smooth muscle cells. So that's why smooth muscle cells start migrating towards from the tunica media to the tunica intima. Okay, and now hemodynamic changes. What are the hemodynamic changes? Basically, atherogenesis observation that reveals that plaques tend to occur at ostia. Ostia means the opening of the vessel. Like these are osteas, or maybe these are ostia and these are osteas. These are point of ostia of the existing vessel at branch points. Like this one is branch point, okay, where they are turbulent flow. Lipids, what is the role of lipid? Lipid typically are transported into the bloodstream, bound to specific apoprotein. We all know that biochemistry, in biochemistry, chylomicrons and VLDLs are basically lipoprotein that transfer cholesterol to our periphery. These guys are bad, okay, like chylomicron, okay, VLDL and LDL. These three are very bad guys, okay. So what they cause? Basically, these are lipoproteins contains cholesterols, fatty acid, lipids, etc., etc. Cholesterol also, okay, to up to some extent. Now these guys start traveling from liver to the peripheral, or maybe they start transferring cholesterol to the periphery. So that's why lipids can accumulate in our vessels. Now here is a HDL, a very good and nice guy. What they cause? HDL basically brings or maybe transfer our bad cholesterol to the liver from the periphery. So this is a basic or main difference between HDL and chylomicron, VLDL and LDL. Or actually yes, here is also an intermediate dense lipid. If a person have familial disease related to hypercholesterolemia, that person have higher chances to get atherosclerosis in their walls, okay, or maybe due to this lipoproteinemias can result from mutation in genes that encode apoproteins and lipoprotein or form disorder that decrease lipid metabolism, okay, like nephrotic syndrome. What happens in nephrotic syndrome? In nephrotic syndrome, basically our protein leaks out into the urine, okay. And alcoholism, we all know that large intake of alcohol can cause cirrhosis of liver, and if there will be a damage to liver, then we all know that our majority of the proteins made by available, like albumin creates osmotic pressure. If there will be a not enough osmotic pressure in our bloods, what happens? Fluid leaks out into the interstitial compartment. With fluid, a lot of protein, a lot of LDL molecules also secrete into the tunica intima that will cause atherosclerosis. And hypothyroidism and diabetes mellitus. We all know that what is diabetes mellitus. Diabetes mellitus basically they can cause vascular neuropathy. So that's why in above I explained in detail what they cause diabetes mellitus to the human normal person if we will cannot get enough or curable treatment from the doctor side. Smooth muscle cell abnormal behavior. What is the abnormal behavior of smooth muscles? Okay, basically, in normal fashion, smooth muscle cells cannot proliferate. But in atherosclerosis plaque formation, smooth muscles can start proliferate. Okay, just underneath the endothelial cells. Just underneath the endothelial cells. Enlarged and just promote LDL, smooth muscle only performs their minor functions. Okay, but no, smooth muscles eat LDL to make form cells. Okay, increase production of extracellular matrix like collagen, extracellular matrix like collagen, etc. Okay, and high concentration cause death of the endothelial cells and smooth muscles. Smooth muscle cells and macrophages become obese by eating and burst that cause leaking out necrotic fabric. What happens when there will be our macrophages and smooth muscle cells start eating and they are going on eating, okay. For example, this one is normal smooth muscle and this one is smooth muscle cell and this is macrophages. They start eating. These are a bad guy like LDL or VLDL or chylomicron. They start eating lipids. What happens? These cell become this like condition. They become obese, but they don't stop eating. So what happens after some time? They become very fat, and they don't even stop at this situation. What happens at the end? These cells start rupturing, and we all know that macrophages engulf bacteria also So that's why these material they can that push out into the macrophages or the smooth muscle cell. These debris, this is the debris like necrotic debris. So this necrotic fibers start accumulating in our tunica intima, just below the, just underneath the endothelial cells. No, next, what happened? Number of smooth muscle cells become more by proliferation just underneath the endothelial cells, forming fibrous cap. What happens? What is the fibrous cap? Basically, this is our, for example, endothelial cell. Okay, this is our. Let me draw two sequences, two lines. This is our tunica intima, and we all know that just underneath the tunica intima, these are tunica media. These composed of smooth muscle cells. These smooth muscle cells start migrating into the tunica intima to adjust LDL, etc., etc. Okay. Now what happens? These smooth muscles just line up underneath the endothelial cells to make a cap. This is called fibrous cap. Atherosclerotic plaque have three principles. The one principle is cell-inducing smooth muscle cells, macrophages, and T cells. Remember these 3 points. Inducing smooth muscle cells, macrophages, and T cells. Very simple. The second thing is as extracellular matrix, also like collagen, etc., including collagen, elastic fibers, and proteoglycans also. The third thing is that intracellular and extracellular lipids. You know what? Like here is a lipid, like here is a from cell, maybe it's macrophage or maybe it is smooth muscle cell. When there will be a rupturing to these cells, what happens? Extracellular lipids are always present, and intracellular, that is maybe a cell, smooth muscle is a cell, and they have LDL. So that's intracellular and extracellular lipids present. So these are three present in fibrous cap. Okay, according to American Heart Association. According to American Heart Association, there are 6 classifications of atherosclerosis plaque. According to American Heart or H Cardiac Association, okay, there are 6 types of atherosclerosis. Okay, the first 3 are normal. Okay, they cannot harm any much to the patient. Like let me draw first type of. This one is our and these are our smooth endothelial cells. Okay, in which you all know that these are initial lesion about 1 centimeter. This is just only 1 centimeter. Fatty rods. We all know that these blue dots are like fatty dots. Okay, composed of lipid field form macrophages. Basically, here are only few macrophages are available that eat LDL or lipids like things. Okay, so that's why there are only fatty dots available. This type cannot harm. Sorry, type 1 cannot harm much of to the patient. Okay, are only minimally raised and don't cause any significant flow to the disturbance. Okay, this cannot cause any harm to the patient. What is type 2 and what happens in type 2? Basically, in type 2, there are more like look like this diagram. Okay, simple one. No, here are just 2 macrophages. No, there are a lot of macrophages present and they have lipid in them. No, they become like streaks of lipids. So these are streak-like appearance, or maybe we call fatty streaks are present. And we all know that there is a psychic effect, or maybe there is a important, or maybe a we just call that amazing effect, that within the 10 years of age, you all have fatty streaks in your vessels. If you have better lifestyle, then you this fatty streak cannot develop further. And if you take alcohol, and if you do smoking, and much more factors are also influence this factor fatty streak to grow, like familial disease like hypercholesterolemia, then this fatty streak will be grow and change into the atherosclerotic plaque. Otherwise, if you live a normal and better and hygienic life, then this fatty streak cannot develop further. Okay. No, this type 2 is also not harm to the patient or person. No, there is a third type. And what is third type? Basically, like above example, here are fatty streak presence. No, lipids present extracellularly in this type. Okay, lipid present extracellularly, and fat intermediate, we call intermediate lesion. This is also cannot much give harm to the person. Okay, the first three are harmless. No, from 4 to till 6, these are very harm to the patient or a person. Type 4. What is type 4? Let me draw a diagram. These are our endothelial cells. No, here a fibrotic, or maybe you made called extracellular fats surrounded by foam cells. We all know that after ingesting LDL by macrophages and smooth muscle cells, they become foam cells. These red area is extracellular fat. Okay, or you may call a deposition of extracellular fat at one place or surrounded by foam cells. This is called atheroma lesion. Atheroma lesion. Okay, whenever we learn about stable angina, then we will learn about type 4 lion, because in stable angina we will see atheroma lions. So that's why if a person has stable angina, in what happens to that person, if he will take proper rest, then no more pain. Okay, whenever he will doing hard exercise, then he will get pain like angina pectoris. So in angina pectoris, in stable angina, we will see this type of lion, type 4. What is type 5? Sorry. And what happens in type 1, type 5? Let me draw this one. Okay, this one is tunica media, and this one is tunica edema, and we all know that this is tunica. Oh, sorry, endothelial cells. No, a fibrotic scar. Lipid molecules, a big lipid molecule or extracellular lipids also present in the center and surrounded by a lot of foam cells. After that, we all know that extracellular matrix secreted by smooth muscle cells. We learned about that extracellular matrix. What is an abnormal behavior of smooth muscle? They can proliferate. They can secrete extracellular matrix. Then this one is extracellular matrix, like collagen, like proteoglycans, like elastic fibers. They cause rigidity. They increase the rigidity of the plaque. They make it more solid. Okay. Now, up to this, here are present lymphocytes also, and lymphocyte triggering macrophages, more muscle cells to eat more and become obese. And what happens in nest? They burst out, and the story is finished. Okay, what happens in type? This type B is called fibroathema. Okay, this type is called fibroathema. And what is type 6? Okay, in type 6 basically same diagram, but here is only one difference, two difference basically. What happens in this diagram? Look at this diagram. Just forget about 5. Okay. No, we can't. Type 6. What happens whenever there will be a, for example, macrophages eat lot of worm cells and they can't stop doing eating uh, LDL. So after that, after become much obese, okay, they become ruptured, and whenever they become ruptured, also necrotic debris start accumulating in the clinical intima. And what happens? We all know that here, where the edges of fibrous cap are very thin. From here, these can rupture endothelial cells and start accumulating above the endothelial cells. Okay, this is called platelet adhesion. Platelet adhesion. What is platelet adhesion? Platelet adhesion is that in which platelet adhere to the non-platelet surface. This is called platelet adhesion. We all know that in human. This one is human. From the human blood cells flow. Okay, so or our blood cells also contains platelet. Everything in that circulation. Okay, so they start adhering to this site. After that, platelet aggregation occurs. What is platelet aggregation? The platelet aggregation is the process in which platelet aggregate or adhere to platelet platelet wave surface. So this platelet aggregation occurs. After that, what happens? Fibrin or fibrin cap make above this one. And what is fibrin cap? Fibrin cap basically it is a process in which soluble fibrin convert into the insoluble insoluble fibrin. So they make a thrombus above endothelial cell. And one more thing is that we all know that during the process of healing after inflammation, new vascularization occurs. Here are new vascularization, and these vessels are very premature. So they start also rupturing and accumulate blood into this area. So intraplaque hemorrhage will be seen in this case. But this is more dangerous type and may be seen in unstable angina. Okay, unstable angina pectoris. What happens in unstable angina pectoris? Basically, this plaque will be ruptured by the flow of blood, or maybe any external stimulus, or maybe any hormone induced stimulation like adrenergic receptor. If stimulate, they will cause increased heart rate. Increased heart rate lead to increased cardiac output. Increased cardiac output lead to the increased blood pressure flow. So that's why whenever blood passes very fastly to this region, this clot will be uh, ruptured or maybe hang from the normal position toward the uh, luminal sides. Okay, so this thrombus may be shifted from its stable position to the unstable position and may block here lumen of the artery. Okay, so this is a type 6. Hope you will find enough information from this atherosclerotic or arteriosclerosis lecture. Inshallah, we will learn more about myocardial infarction in our upcoming videos. Up to this, I will explain everything and every inch information you just need to remember. So hope you will enjoy the lecture. Allah Hafiz. Remember me in your prayers and Allah Hafiz.